All right, welcome back to the Advancing Healthcare Innovation Show. I am Michael Stamatinos, your host, and I'm just so excited today to welcome our guest, Eran Kabakov, who is the CEO of Docola. And essentially what his technology is doing is they're able to prescribe knowledge and provide it to patients. And it's a really robust communication platform. And just for those of you that are just joining us for the first time, a little bit about Advancing Healthcare Innovation Show. What this show is all about, it's about highlighting stories of real people that are really innovating within the healthcare space. So we interview a number of different healthcare technology companies, entrepreneurs, investors, innovation folks on the payer and on the provider side. And the objective, again, is to provide value to you, the viewer. So if you're on this, which if you like hearing this, make sure you be sure to subscribe. There's brand new videos that are coming out on a regular basis. So without further ado, Eran, great to have you, brother. How you doing?
I'm great. Thanks for having me. Appreciate the opportunity.
It's my pleasure. So talk to me a little bit about Docola. I mean, it's been quite a journey. I'd love to hear sort of the reason why Docola is in existence today, and has that changed from when you started to now that we're kind of going through COVID? What's changed? And love to hear a little bit more about the mission, the vision, and why you guys exist.
Absolutely. Well, before I talk about Docola, I'll talk about the why behind it. You know, I'm a healthcare provider, been in healthcare for over 30 years. The majority of it as a clinician, as a physical therapist. And back in 2001, I was working in the clinic, and I recognized that I was basically repeating myself on a regular basis. I was spending a whole lot of time saying the same thing over and over and over. And so I basically said, there's got to be a better way. And I started playing with technology. Fast forward 20 years. And here we are talking about the platform that has been really the end result. Docola is a care communication platform that enables clinicians to aggregate information from any source, combine it into what we call courses that are then prescribed to individual patients or large patient groups. And really the mission for us is to increase access to knowledge in healthcare. It's to reduce the burnout of clinicians. It's to reduce the cost of healthcare in general, because outcomes are not there, because patients not necessarily knowing what to do, and to just really improve the overall experience for everybody involved. We started before the prototype was released in 2005, 2006. There was no HIPAA. You know, HIPAA, I mean, the guide was, the law was already there, but it wasn't really enacted yet. And so there was a whole lot of stuff that we had to figure out as far as the legality, the regulations. I think from an innovation standpoint, the biggest part that we had to come up with is figuring out the business model. When you look at healthcare, it's so different. So that was our biggest point of innovation.
Well, speaking of innovation, how do you, it can be broadly defined. How do you personally define innovation?
Tough question. Innovation is, to me, is a process improvement in a functional manner. So, you know, you can innovate, and you can innovate by creating something new, but hold on, let me just close the door. I'm sorry. Apologize.
It's the real world. It's COVID.
Right? Exactly. So back to innovation. You can create something new that is not functional and not going to improve something. For me, innovation, specifically in healthcare, is not just making something new, but making something that can be put into action and effectively enhance the process that you're dealing with.
So talk to me about what that's been like as far as how Docola fits into a previous process, and maybe give us like a real world story, an example, because I think the whole entire purpose of this is for people to actually see innovation at work. And what does that look like? So if you wouldn't mind, do you mind giving us sort of a real world example of how you guys have innovated in sort of and it can be across various environments, because I know that you and your team operate across numerous healthcare environments, but
sure.
How about it?
So I lost the first part of your question. I apologize.
Showcasing innovation, like actually being implemented.
Okay.
What has Docola done in terms of innovating within healthcare environments? I know you guys operate in a few different ones, but what does that actually look like? So if you can use sort of a story to kind of crystallize it for the audience, I think that'd be great.
Absolutely. So let's talk about the basic aspect of Docola. Is we're talking about sharing of information. When you're looking at how healthcare shares information today in 2021, it's pretty much the same way it's been shared 100 and 200 and 300 years ago. It's verbally. You go to the doctor, they'll tell you what it is that you have, what it is that you need to do. And then they maybe send you home with some sort of a handout piece of paper. That's communication. So where are we innovating? Well, we're taking that process and we're making it extremely simple for the same doctor to aggregate all the information that they would tell me about my knee pain, right? Put it in a course that they can prescribe to me that has the doctor talking about knee pain, a video by a third party about the anatomy of the knee. They can be, the handout as a PDF could be provided to me. I can have a little 3 quiz questions about what is the knee, how it works, and then a quick exit survey, plus an outro video of the doctor saying, I hope this was good for you. And if you have any questions, call my office. And that piece that I just created can be prescribed to 1,000 patients a day, right? So you take something that today is archaic and it's time consuming and it's energy consuming, and with a little bit of work, you make it highly effective in the practice. So that's the part of innovation. And really for me as a clinician, iteration and reiteration is critical. I'm a technology guy, so iteration and reiteration happens daily when we work with code, but I have to be able to deliver information to patients and make sure that when they come back, they actually understand, and I can see that what I'm saying is conducive to outcomes, right? Mm-hmm. And that's something that as a clinician, I'm not able to do. And even if I am able to do in the real world, I don't have the capacity to iterate and reiterate because it's very expensive in resources and energy. So let's talk about examples. About a couple of months ago, probably now 3 or 4 months ago, with the way time flies, but a practice director of a bariatric surgery clinic called me. I know her from a different life, and she got in touch and she said, listen, with COVID, we are just really struggling getting patients through the door. We cannot see them face to face. We need something virtual. Can you help us? And I said, absolutely. She said, well, how much is it going to cost and how quick can we do it? And I basically said, we'll call her Lisa. I said, Lisa, do you have 15 minutes right now? She says, yes. I said, okay, so it'll take 15 minutes and it'll cost you nothing. And in 15 minutes, I'm not joking, we had an account up and running, right? Basically we did a Zoom. She signed up for the account. She already had most of the information that they share with patients as handouts. So we created the first version, right? Because I told her iteration, reiteration. Right now you have a big pain. Let's take what you have, put it to action. And as this is starting to work for you, on the side, create a second version that you'll push. So basically in 15 minutes, we had the account running, we had the course up and running, and by the end of the day, she already had several patients on the platform, getting the information they needed to get to the to get to the first appointment with the surgeon and really to surgery. Now, that was awesome. I'll tell you what was, to me, was a bigger win. The director, the head doctor in the practice, the surgeon, he's in his 60s. And when I talked to her a couple of months afterwards, she said, you know, basically she said, look, he was extremely against any type of technology. Even the electronic medical record was an issue. He loves this now. And I said, okay, that's amazing. Why does he love it? And she said, because now when a patient comes in, he can actually sit and have a conversation with the patient like he did back in the day, you know, and all this new technology kind of rubbed, you know, he has to click into the EMR and all that kind of stuff. Well, with Docola, he basically sees the patient and he has a conversation and the patient is ready for surgery. I'm like, even better. So that's the example from real life.
Thanks for sharing that. It's sometimes, you know, when you think about healthcare innovation, there's the sexiness part about it, and then I think there's oftentimes an element that is not really spoken about how there's a grittiness to it. There's a lot of persistence and tenacity. In your case in point, you know, obviously this is a wonderful success story. What do you think have been some of the biggest blockers in terms of, you know, innovation from being proliferated? Where do you think that things are being held up, and how do you think COVID has impacted those blockers?
Well, I'll tell you, I mean, blockers in innovation is simple. Any startup needs funding. We have been ahead of the curve from the beginning. We're still ahead of the curve in the sense of thinking what I call care communication, the information sharing between patients and healthcare providers and vice versa, is really a stepchild in healthcare. It's not being thought of as as something that is necessary, which to me is ridiculous. So before COVID, when we would talk to investors, it would be, yeah, I get it, but it's not sexy enough, you know? Are you doing AI? I'm like, well, yeah, we can definitely, absolutely do AI within what we're doing, but that's not the driver. Well, you're doing, blockchain? Like, again, blockchain can be part of the solution, but it's the bigger picture. When you talk about innovation, for us, a blocker was getting the right investors to understand what it is that we're doing, and it still is a always obviously an issue. Another blocker is the acceptance from the market. Healthcare is very, very conservative. You're bringing something new, there's always going to be a pushback from every direction. And over the years, really, the way we have overcome it is our success stories and word of mouth. If you go and you search on Google about us, you will find a lot of information, but we're not advertising, because advertising is it's too early to advertise. We need, you know, the word of mouth is still better and stronger for us. COVID was tremendous accelerator, because once you took away the face-to-face communication, suddenly a platform like ours becomes natural adjunct to what it is that they're doing. And so it is a lot easier to talk to a practice or healthcare organization today and tell them, yeah, what we're doing is asynchronous telemedicine. Oh, okay, tell me more. Well, asynchronous telemedicine is basically the information that you're sharing like telemedicine, but between telemedicine appointments. It's, you know, you share information, you can collect information. And if you're not doing it, and hopefully some of the viewers that you have here on the show today are healthcare providers or administrators, if you are doing telemedicine and you're not sharing information right after that for the patient to engage with and to learn and work with, then you're missing a tremendous opportunity to support and improve the healthcare of that patient. And Docola, by the way, I'll say it again, is free for healthcare providers anywhere around the world.
Globally. Interesting.
Globally, yes.
It's interesting that you say that, you know, after some sort of an intervention of some sort, that there's often just not really something in between. And do you think conventionally healthcare knew that that was a problem? And do you think now that, you know, there's even more of sort of a gap in the sense that people are opting more for virtual visits? Do you see that this problem has now sort of has risen, you know, from a prioritization standpoint? Where do you think now healthcare communication falls on the stack of problems to the people that you have been trying to get the attention of?
It's higher, but I think that the perspective and the point of view is still not where it should be. It's like it's like an inflammatory process that is under the surface, but it's not high enough where there's pain involved, right? But it still is destructive to the system. It's like diabetes in a human being, right? The person can have diabetes, not know they have it, and it's really ravaging the body. So again, I think that the clinicians are more aware that they need to communicate through other means, and virtual is one of them. But they're not understanding the implication of communication not being effective. What I mean by that is that when you look at the conversations in the doctor lounges, I'll call it, and there's the conversation about burnout. You know, I'm just burnt out. There's many reasons for it, and when you ask why, a lot of times the insurance burden and electronic medical record heavy load work comes up in the conversation as the issue. But really, when you start drilling down further, the clinicians will say, well, you know, I invested so much time and energy and money in becoming a healthcare provider, and I'm not a healthcare provider. I'm a pencil pusher or a paper pusher. And I'm not really getting to spend time with my patients. I don't get to talk to them. And so really the issue is that there is no communication happening. There's no effective communication happening between healthcare providers and patients. And that's because the system is so oriented on billing codes, on getting patients in the door and out the door, that clinicians are basically, you know, are all they can do is fight to keep head above water. They cannot think about, well, how can I communicate better? And
it sounds like what you're saying is that it's coming from a reactionary stance as opposed to being proactive and seeing how they might be able to innovate. Do you find that because that type of environment is very reactionary, or do you think that seeing that care models are moving more towards value-based care, what kind of impact do you think that's going to have, or what do you think what kind of an impact can Docola have, especially when things are moving into more of value-based care, which has an element of patient experience that's, you know, very, very closely tied to it?
Well, I think that once patient experience takes a more central stage, that there's going to have to, clinicians will have to find solutions like us. I think that the reason why things are as they are now is that because it is a reactionary. I mean, you know, like basically there's, well, I have a gap, I'm going to fill it. You know, I mean, a good example is a few years ago, I went to the emergency room because I was suspected to have appendicitis. Well, I walked in, and I'm a clinician, so I understand the healthcare system. And I was in a room or whatever. And then when I left, I did not have appendicitis, but I still had the pain. So I was released, and they gave me patient instructions. And I kept it for the longest time. I probably have a scan of it. It was the most ridiculous document ever to send somebody home. You know, I came into the OR with the pain. I left with the same pain, with the instructions completely useless. And I got a bill for 15 grand for it too. So, you know, would that make me think twice about going to the emergency room with an issue like that again? Yeah, probably, which means that the hospital is now losing business because they didn't communicate well enough, both on the experience, on what to do. They never really followed up with me afterwards. So patient experience, yeah, is going to drive more communication, but we have a really, we still have a long road in educating and supporting the clinicians with what are some of the gold standards, what are the good ways, how can you do this efficiently, and why.
Yeah, I mean, it sounds like what you're doing is you're addressing some of those care gaps, you know,
Yeah,
through what you're doing.
big time. But you know, we touching on the care gaps. That's when you're looking at clinically. If we step back a second and look at the bigger picture, we really we are a tremendous marketing tool for a healthcare system, right? I mean, you have somebody who's coming into the hospital, getting care, and leaving. And healthcare systems are very competitive nowadays, and they want to keep a relationship with the patient. Well, if you just send them home, that's great. But if you send them home with an account on Docola, and that account constantly brings up information that is pertinent for that individual when they're healthy, not when they're sick, when they're not a patient at that point, they're an individual in the world. But imagine if Mount Sinai in New York, let's say, all their patients before COVID had accounts on Docola, and COVID happens, and now you want to send them information that is, you know, accurate and quick, that is accessible on any device. And all you do is you upload it to our platform, and you start pushing it on a regular basis. Now you're communicating every time somebody, you know, checks their email. It says, oh, you know, some update information from Mount Sinai about COVID-19. I'll sign up for that. I want to hear it from the clinicians versus the media and everything else. I want to know what's going on. So there's the caregiving, there's marketing, there's healthcare provider education that can happen within our ecosystem. It's communication. It's just so big and so overlooked in healthcare. It's crazy.
You know, you said something that triggered something, because I wanted to highlight this other particular project you're working on around caregiving. I know it's something that, you know, it's near and dear, and I'd love for you to sort of share that with the audience, just because I think it's something that it's extremely valuable.
Sure. Well, so yeah, this weekend we're going to be hosting a documentary film by Dr. Jessica Zitter. Dr. Zitter is the director of this film. Her first film, Extremis, is actually on Netflix, and her second film that we will have on the platform this weekend, and it's available for clinicians who have accounts on Docola. It's about the burdens and struggles of family caregivers who are caring for loved ones at home. It's you know, she had the couple in the movie are you know, basically the woman was a patient of Dr. Zitter, and she followed her from the decision of not receiving any more care and going on palliative care until she passed away. It's extremely strong, very powerful film. You know, touch a point for me because I have seen it in my family, so I've experienced it in my family. But also as a clinician, you get a glimpse at an aspect of healthcare that you don't see as a clinician unless you are in palliative care. So basically, we are collaborating with Dr. Zitter's team, you know, where the film will be available on the platform as a video on demand for 3 days for clinicians, and then we'll have a live Q&A session with her. And you know, we're sending a lot of invitations out, and that's helping us get some new traffic on the platform, which is great. So you should probably expect to see more projects like this in the future from the Docola team, collaborating with film producers and artists, and in order to enrich the community that we have.
Eran, so we're definitely going to link that in the description down below. Make sure that everyone checks it out. And Eran, I'm just so grateful, number one, for your friendship and just the level of passion that you have for patient communication and the journey that you've been on. And I'm very grateful that you've been able to sort of just be rigorously honest with our audience and talking about little wins and talking about frustrations. Again, this is about real people, really innovating and what it takes day in and day out. And it's not a walk in the park, and it isn't for the timid. It's something that is an ongoing struggle. And having seen the types of successes that you've had, and I think it has a lot to do with sort of who you are as a human being, as a leader. But it's about providing access, and as you know, that's something that I'm extraordinarily passionate about. And in this case, you're providing access to information that can be provided to patients that somehow impacts their care. So yeah, we'll provide all those details and information. And if you've liked this interview, folks, make sure you like, subscribe. That always helps out. Make sure you share and leave a comment. We'd love to hear from you. And look forward to seeing you on the next interview. Take care, guys. Bye for now.